Hi, I'm Dr. Trisha Torga. I'm an adolescent medicine specialist from Children's National Hospital in Washington, D.C. Yeah, so I think it is starting to become more and more important for pediatricians to talk about social media. um, just in general, especially in skincare right now. Like I've mentioned, because this is something that's actively changing in young people, it's developmentally normal for them to be comparing themselves to their peers. Social media is just naturally going to come up. But what I've learned just in practice as well is how there are so many young people now who follow medical advice or like quote unquote medical pseudo medical advice on social media. And if we do not ask them, they will not tell us. For example, and I don't know if you've heard of the term, they're starting to coin this term like cosmetic correxia, where young people are really affected, like young people are like obsessed with having clear skin and that they're spending so much time on social media, which I'm seeing more and more in practice. I have kids sometimes like with the questions that I usually ask my young people, that the adolescents that I see around sleep and all that stuff. I found I will find out that they're not sleeping enough because they feel like they need to have 2 to 3 hour skincare routines that they have to do so early in the morning or at night, and it's impacting their grades. Like somehow it somehow it's I'm hearing more and more it's coming back to this obsession for skin, the perfect skin, and social media is really playing a big role around it. So just generally, pediatricians need to be asking the question, and not waiting for the patients to bring it up themselves. And especially when it comes to skin, asking them what they have seen already, what they are currently using, because otherwise they would not tell you. And when we're giving our guidance as pediatricians, always explaining that it may not be as magical as it seems like in social media, because a lot of the treatments that we prescribe would usually take weeks to months to have an effect. But then that's not what they're seeing on social media. So like when they're gonna be choosing in the end, and if you don't give them that counseling, then they're gonna think that social media is better than us pediatricians at the moment. So I think that's like one of the things that I've noticed. Like I prescribe this medications and you're like, well, it worsened a little bit, so I stopped using it. So giving them that counseling that is how it actually works and all this stuff is really helpful just to combat what is out there in social media. And I do want to share that for AAP, we have like what we are using what we call 5 C's of media use, where we are trying to create help our pediatricians with a way to talking to their young people, seeing how not just like how much time they're spending on social media, but how it's actually impacting their individual experience. And like what asking them how they feel about it, the content that they're seeing, how if it's being used to manage their emotions, and if it's displacing important activities in their lives, and trying to just like see what conversations are happening within the household as well around social media. Definitely anyone who's experiencing contact dermatitis that is not getting better with just like discontinuing the skincare routine would benefit from a referral for a dermatologist and potentially an allergist for like patch testing and for like specifically for patch testing. And And in terms of like acne treatment, just because that's what I see a lot and that's what I have been seeing that young people are looking for treatment for in social media. Um, when it's moderate to severe acne and they start to have scarring, which means that will be permanent damage, referral to dermatology is pretty much warranted immediately, especially if we're thinking of using more sophisticated treatment or more intense treatment like isotretinoin. Also, if they're experiencing psychological distress and it's really impacting the quality of life, referral to a dermatologist is also very helpful.